Hey, good morning. We're back. I'm your host, BKP. It is time, Wednesday, 8:45, where our friend Beth Bennett with H&R Block comes by and we talk tax tips. It is tax season. It's almost like deer season, hunting season.
Exactly.
Season,
yes.
right?
Yes. We are hunting tax returns.
That's exactly right. But it is, good morning, Beth. It is tax season. Before we get into our tax tip of the morning, they say it's boring. So let's talk about the weather. Did you hear that hail? Did you have hail?
I was in Chatsworth last night. It did not have hail.
Oh my gosh. I have pictures of people's front yards.
I've seen them on Facebook
yes.
this morning.
We had hail. I had two things at my house. I had hail and a 55-pound dog in my lap.
Hey, yes, that's where we are. Mine is 80.
Remember? Afraid of the storm?
Yes.
Sassafras can't take the storm. Okay.
Not funny.
Didn't you and I have this discussion
we had this,
already?
We did about
because
getting our dog.
I asked if the doggy Xanax could be deducted, right?
The answer is no.
Yeah, we just had this conversation last week. Wow, I don't remember.
That kind of takes us right into our thing today, because I was talking about our health savings account and the way that you can make your medical expenses tax deductible. I wonder if I could move his expenses into that, pay him out of that. It's a prescription.
I tell you, got to do something. But it was quite a storm. It came through last night. It was, they say only in Georgia, right, where it was last week. We had snow, and within 7 days we had an 80-degree day. It was
it's
beautiful.
crazy, isn't it?
Absolutely. Okay. Now you talked about something. Now we're hearing you guys, and let me tell you out there, if they're open year round, okay. And there's so many changes that will happen in the healthcare. It will happen.
It's happening. It's
going to happen. There's so many changes that are going to happen. And what are you responsible for? What is taxable? What is deductible? What is a tax credit for healthcare? These questions you will have, and this is who you need to come ask, because they're open. Beth Bennett's H&R Block is open all year round. You do returns. I don't want to mess it up. You're busy doing returns. That's not the only thing you do. You counsel in tax.
We help you prepare to have the best outcome on your tax return possible.
Doing your taxes is all year long. It's preparing all year, correct?
Yes, it surely is, Brian. It's not just that one day in tax season that you do your taxes. You need to plan for it all year.
Well, things get confusing, and we thank you very much for coming in and helping us clear some things up. And I know on a daily basis you guys get new things and new rules that you have to cover and go train and learn about. Health savings plans. We hear a lot of that. I hear HHS Secretary Tom Price. I hear a lot of this on TV. The new health care plan that they're trying to put in place will now go back to health savings plans, how they work, how you do it. Explain a little bit of what a health savings plan is.
So a health savings plan is a fabulous way to get to maximize your tax credits on your medical expenses. So if you're in a job and your employer helps you pay your insurance, right? Generally, almost all of your health insurance is taken out of your paycheck before taxes. So it reduces your taxable income each week, right? So yay for that, tax credit there, okay? But then most of us have insurance that have, deductibles are much higher than they used to be, right? Since the Affordable Care Act took place, deductibles went higher, co-pays went higher, more money out of someone's pocket. Even though you had health insurance, you're now paying more for everything that you do, right?
Exactly.
That's how it affected me. So with the health savings account, you can put up to, if you're a single person, $3,350 into a health savings account. A family, so that goes not just being married, but it's a single person or a family, then you could put up to $6,750. If you're over 55, you add $1,000 to either one of those to do catch up. So you put that money in that health savings account, which to many people's disbelief, it is not just an account you can get through your employer. A lot of people think you can only do that. Oh, my company doesn't offer that. You can get that through a private insurer. It doesn't have to be through your job. So no matter, even if you have your insurance through your employer, but they don't offer that, you can go to a private insurer and open a health savings account. And then what you can do with that, and this is the beauty of it, because typically everything you pay for your medical expenses is taxable income, right? Because it's after you paid taxes on it, after your paycheck, then you don't get to deduct it. Because hardly anybody ever gets to use medical expenses on their Schedule A, because it's got to be over 10% of your annual income. And that's really hard to meet. That's unless you've just had some major catastrophic
So medical expenses, let me try to get this, and I don't want to confuse it, but let me get this straight. If your employer is providing some of your healthcare cost, then at that time it is taken off of your gross, or taken off where
the part that you pay. So for example,
the part you pay.
We pay about $100. The way my husband's insurance is done, it's broken out, and some of ours is taxable, like our short-term disability, our long-term. So there's like 5 different categories that are taken on insurance out of his. But like $75, I think, is just medical and dental. And so just say he made $1,000 this week, and they take $75 for insurance, right? So now only $925 is taxable.
Okay, all right.
Does that make sense?
Yeah, all right.
Right? So you kept $75 of your income from being taxable this week. At the end of the year, it makes a difference. It helps.
All right, okay, so now your medical expenses, to deduct those, it has to be in excess of 10%?
And you have to be already doing a Schedule A. You've got to itemize. So most people, in order to be able to itemize on their tax return, usually have to have a home mortgage with, and with the interest rates where they are today, a lot of people still don't meet that, because, you're paying 3% interest on your mortgage now versus, 15 years ago we were paying what, 10? So, a big difference. So the A is really hard to meet. But if you get a health savings account, and you put, just say that I go to the doctor regular, I have all these prescriptions I take, and I'm going to spend, I average $3,000 a year in medical expenses that I know of. So I'm going to put 4 in there just as a cushion, right? So then when you go to the doctor, like my copay is $30 for a regular doctor, $40 for a specialist. So typically I don't get to take that expense on my tax return. But if I pay for it out of my health savings account, it's a tax credit. Your prescription, your glasses, because a lot of people don't have eye care. That's a separate insurance you generally have to purchase in addition to your medical.
So if you put it in a health savings account, and you get a health savings account card, and you go over and you have health insurance, and your doctor says your copay today is $30, if you will use that card for that money that came out of the health savings, right?
It can be done different ways. Like you can reimburse yourself. You can write your checks or pay with your own credit card, and then you just submit the bill to your health savings account, and it can reimburse. I think there are multiple ways.
Why I said it like that is at one time when I had a health savings account, I had a card. So I guess that's the reason. So
I think there are multiple ways.
Will do that. There's multiple ways, but if you will use that account. Let's just simplify. If you will use that account to pay for your prescriptions, whatever the copay is, to pay for your glasses, to pay for your
like my dental only covers 50%.
Right.
Right? That's the maximum it pays. So half of, I don't know if anyone's got a crown, they're kindly expensive. So that's a big chunk of change. So if you need some dental work, you might want to plan that ahead.
Back off the dental work and the crown. Now you get, my gosh, you're reminding me.
I got 2 last year.
You're reminding me what a crown cost. Oh,
I know, it hurts. That's even worse than going to the dentist. You got to pay the bill.
Okay, Beth.
So,
but I don't want to confuse this. So health savings accounts, they're not actually usually offered through your employer, right?
Some are. Like in Chatsworth, a lot of the carpet mills do.
Do they?
Yes, a lot of the carpet mills have that as a plan that they offer to theirs in addition to. So you see it a whole lot. We don't have a lot of big business here in LJ, so we don't see it as much over here. But in my Chatsworth office, probably 1 out of every 3 people have a health savings account.
So health savings accounts, but you can buy those privately.
You can buy those privately. And here's the beauty of this, and a lot of people were scared of them because, do you remember the Flex Savings Plan? So you put money in that, but if you didn't use it at the end of the year, you lost it. So that got a lot of people like, I'm not taking that chance to put my money in something I might not use. So a lot of people got away from those. With the health savings account, that's in there forever. So let's just say, because we're still very young and healthy, we put $5,000 a year, and we only use $1,000 a year. So each year, $4,000 carries over until we become 80 and need medical regularly and have a lot of bills. It just keeps building up, so then we can use it there. So if you have a surgery, an unexpected surgery, now you have your health savings account.
And you can tell people one more time how much you can put in.
If you're a single person,
how it affects your taxes. Can you deduct it or go against it? So clear that up for me one more time, how you can do that.
So if I'm a single person, I can put $3,350 in that each year. If I'm over 55, like they do with the 401ks and IRAs, if you're over 55, you get a catch up. So you can put an additional $1,000 in it. I think they think when we get 55 that we start becoming old and feeble. I don't know. There's like a stigmatism with 55. So then, if you've used $1,000 of that, that is a credit on your tax return. If you put $3,350 in it, but you didn't use it, then there's no credit, only for the receipts that you actually used. Does that make sense?
Yes, but for what it may not, if it did not make sense, you can come see her. And she can
You
make
know where to
sense.
find us.
Where are all of your locations?
We have Craig Street that you see behind us, which is down there between Pools Barbecue and the drugstore. We have Highland Crossing up near Walmart, and River Street in downtown.
And let me see if I can do my eye test. 706-635-5563. Did I get it?
Awesome. Do a good job every week, Brian.
Yeah, I can't see it. I memorized it.
He needs a health savings account so he can go get some glasses.
Yeah. I have 3 pair. Thank you. 706-635-5563. That's how you can get in touch with Beth Bennett and her qualified staff. And also, don't forget that if it is tax season, they do have business hours, but if you're running late, you have to work late, you have to work weekends. Beth and her staff, they're doing everything right now to accommodate you. If you call, tell them you're on your way, she will work with you any way she can to accommodate you, to help you with your taxes this season. And don't forget, taxes, that's year round, and there's always new things coming out that somebody that you trust needs to pay attention to. We trust Beth Bennett. She pays attention to it, and she's here to help you year round. You good?
I'm good. Thank you, Brian.
Well, you have a nice day. You have a nice rest of the week, and I kept you out of all controversy.
I know, that was just so boring.
Stick around, I could light it up. I'm your host, BKP. We're going to take a break. Find this video, share it with your friends. Everybody needs to hear about health savings accounts and other tax tips in our community business section, on FetcherNews.com. Take us to break, Sam.